I'm going to be speaking on a very controversial topic. We've already had that discussion a little bit in the morning, which is on non-nutritive sweeteners. And I think every healthcare professional is asked this question that should I take it? Should I not take it? And there's so many guidelines and advisories that have come in the recent past on it. So I'll try my best in the next 20 minutes to help you get some clarity on this topic. So as we know, and I think there was a discussion that was happening in the dietetics groups just yesterday because there was some article that came out in the paper about recommendations of sugar. And India is the largest consumer of sugar, across the world, maybe because of our population. But yes, we consume a lot of sugar. And we're also seeing a very high number of people with NCDs, be it, with diabetes, hypertension, dyslipidemia, even obesity, So there is a high intake of sugars, and the quality of nutrients is also, diminishing over the years. And we have enough surveys and studies which have shown us that we are a carb-loving country, and also the quality of carbs that we're consuming is a problem. And therefore, even if you look at all the guidelines, whether it's the WHO guidelines, the AHA guidelines, and we have the recently to be published, the RSSDI-9 guidelines, the amount of sugar is, actually being reduced in terms of how much can a person consume. And today we say that anything below 5% of calories coming from sugar would be much more beneficial than taking more sugar. So definitely there is some amount of, reduction in terms of the amount of sugar that is recommended for an individual, even without diabetes. And we are seeing, I think what we all face, we speak so much about nutrition, we speak about exercise, we speak about lifestyle modification, but the biggest challenge that all of us face is non-adherence, especially when it comes to diet, because we all are slaves to our tongue. We love tasty food. And we also like, sweet, our desserts, and, we have a lot of cravings of them. And therefore, there is a non-adherence that we see, especially in terms of the amount of sugar and sweets that one consumes. And I think we all faced that during the recent festival that we all had in India. And again, when we're looking at sweeteners, you have the nutritive sweeteners and you have the non-nutritive sweeteners. Now, nutritive sweeteners are sweeteners which do give you calories and carbs. And you have sucrose, which is your table sugar, you have fructose, you have corn sugar, you have the high fructose corn syrup, and so many more. And we will be discussing the non-nutritive sweeteners in detail. Now, when we're looking at fructose, so, where they thought that, okay, sucrose is not very good, a lot of people started opting for fructose. And then even if you looked at the industry in terms of all the packaged foods, they started using high fructose corn syrup. And people, indulge in a lot of consumption of fruit. And I think we all know that people start mixing honey to their lemon water in the morning in the bit to lose weight or keep their glucose levels in control. And today we know that fructose, in fact, is more lipogenic than glucose. And increased consumption, especially when it comes from your high fructose corn syrup, which is rapidly absorbed, increases fat accumulation. It also increases triglycerides, uric acid levels, MASLD, as well as glucose levels. And therefore, we encourage to have, naturally occurring fruit sources like, fructose sources such as your fruits and vegetables. And again, there is a limit in terms of how much fruit can a person eat per day. Now, when we're looking at the non-nutritive sweeteners, we have so many non-nutritive sweeteners. And over the years, we have more and more newer ones that are coming in. And the oldest one was, saccharin. And it was, sometimes thought, there was a risk of cancer. And therefore, people stopped using, your saccharin in between. And then you have stevia, you have aspartame, asulfame K, sucralose, and neotame. Now, if you look at their chemical composition, if you look at sucralose, it's a disaccharide made from sucrose. Stevia is from steviol glycosides. Aspartame is a methyl ester of 2 amino acids, which is aspartic acid and phenylalanine. And again, if you look at the sweetness, you need to use very, very less amount of these sweeteners because they are, in terms of its sweetness to sugar, they are sometimes even 300 to 600, like if you see saccharin, whereas sucralose is 400 to 800 times more sweeter than sugar. So therefore, you really need to use lesser amounts. Now we have something which is known as ADI, which is the acceptable daily intake. That is what the guidelines recommend. And if you look at saccharin, it's around 5 milligrams per kg body weight. So if somebody weighs 50 kilos, the person can consume up to 250 milligrams of saccharin a day. And the most popular ones, which are sucralose and stevia, if you look at sucralose again, it's 5 milligrams per kg body weight. For a person weighing 50 kilos, he can easily consume, or as per the recommendations, is allowed to consume around 250 milligrams of sucralose per day. So this is, can you mute, please? Can you mute, Mr. Satish Kumar? Yeah. So if you look at the amount which is acceptable daily intake, it is way higher than what our people really consume, which I'm going to discuss in detail. I'm also going to be discussing the metabolism of these sweeteners. Now, sugar alcohols, and this has again become very popular, especially in all your keto products that are available. Now, they are again 25 to 100% more sweeter than sugar. The ATI is 20 to 30 grams per day, and they're generally recommended as safe. However, overconsumption of these may actually lead to certain gastrointestinal disturbances. It is allowed in pregnancy, but in children, it is best avoided. And even if you look at the most commonly available sugar-free ice creams, which have got sugar alcohols, they say it is not recommended for children. It is stable. So if you look at the stability again, sucralose, stevia, as well as your sugar alcohols and asulfame K are stable at high temperatures, and therefore can be used even in baking or, making certain, like if you're making Indian desserts, etc. Now, sugar alcohols are not completely carb-free or calorie-free. They're only 50% digested, and therefore, when we're looking at the food labels which have got sugar alcohols, you actually calculate just 50%, and you minus that from the total amount of carbs to get your net carbs. Now, this is something that I would like you to pay attention to, which is a term which is known as NOAEL, which is no observed adverse event level. Now, when they are actually testing the safety of sweeteners, because you're all worried about safety of sweeteners and what can it cause in terms of, the side effects, the harmful side effects because of these sweeteners on health. So whenever they're testing the safety, they first arrive at the NOAEL, which is actually 100 times more than the ADI. So when they are saying that, okay, it's 5 milligrams per kg body weight, actually the NOAEL, that means the level at which they really do not see any kind of a harmful side effect is actually 100 times higher. So therefore, within the ADI, if people are consuming it, it is considered to be safe. Now, what is the estimated daily intake? It's a typical human intake of the sweetener, which is below the ADI. And this is what typically people would use. So if you look at an ADI, which is 40 milligrams per kg per day, then the NOAEL is actually 4,000 milligrams per kg per day. And this is where you will see that, the harmful side effects come in. And therefore, the ADI is well within the limits that is recommended. Now, if you look at the absorption, digestion, metabolism, and excretion of non-nutritive sweeteners, aspartame, as we know, it actually breaks down into the gastrointestinal tract, and only the digestion products, which is methanol, and the two amino acids, which is phenylalanine and aspartic acid, reach the circulation. And even if you see, these are commonly available in your natural food sources, especially fruits, vegetables, tomatoes, protein foods such as meat, fish, eggs, dairy, or legumes. And therefore, aspartame, if it is a person with phenylalaninuria, then we would not recommend this sweetener. Asulfame K, somebody with a kidney condition, we would not recommend this, especially if they're having high potassium levels. So therefore, the safety again has to be looked at in terms of any associated medical condition that the person may have. Now, steviol glycoside is hydrolyzed to steviol before absorption, and it is glucuronidated in the liver and excreted in the urine as steviol glucuronide. Now, if you're looking at sucralose, which is again one of the most commonly used sweeteners across the world, it is very low in terms of level of absorption and little to no metabolism is reported. So if you see, again, it's safe to consume because it doesn't really, go through the entire absorption or metabolism process. Now, this is what actually caused a lot of confusion because the WHO came out with a directive that we should not use non-nutritive sweeteners. And what they actually meant is it should not be used in people with weight control. Because if you see, and I'm sure all of y'all will agree with me, that people start having, sugar-free sweets and sugar-free desserts, and they will have it by the kilo because they think it has got a sugar, basically a non-nutritive sweetener. But they do not realize that, it may have a non-nutritive sweetener, which is a substitute for your sugar, but it still will have maida or refined flour or any other cereal or any other kind of, grain flour, along with all the other fat. Because when you're going to do anything which is like a baking, you need a lot of fat, especially a butter, margarine, etc. And therefore, it's still not a healthy choice, even for people, who want to lose weight. And therefore, they came out with the directive that is, suppose somebody is looking at losing weight, then they should avoid using non-nutritive sweeteners because it really doesn't serve the purpose. However, it is not applicable for people with diabetes, and the recommendations are conditional. So they actually gave a directive that each country should actually look at these recommendations and then set their own guidelines depending on what is the kind of consumption in their country. Now, that's why a lot of confusion that happened, but people really did not look at, the guidelines in totality. And therefore, there was a lot of, confusion. And a lot of people actually went on an overdrive to say that, okay, sweeteners should not be consumed. However, it's very important to look at the guideline document carefully. Now, even if you look at all the studies, so randomized controlled trials have shown a reduction in body weight and BMI in adults. However, no change in other measures of adiposity or cardiometabolic health was observed. However, prospective cohort studies have stated that NSS intake in association with, it increased the body weight and increased risk of type 2 diabetes. However, when we're looking at these studies, we need to look at more research. And now there is a lot of research being conducted in our own country at Dr. Mohan's center, and I'm going to be discussing about it in the next few slides. So further research is needed to determine whether the observed associations are genuine, or it could be just a result of reverse causation or residual confounding. What are the other factors that could have increased the weight gain or increased the sugars? Because people could have just replaced, the non-nutritive sweetener for the sugar, but then what about the other aspects? Were they also, similar in both the cases? That is something that we need to look at. Now, when it comes to, a response to the WHO guidelines, the British Nutrition Foundation was the first body which actually came out and said that, considering the conditional nature of the recommendation and the fact that all sweeteners in food supply have been rigorously tested, like we said, NOEL, if you look at the amount, then you look at the ADI, and then you look at the EDI, it seems sensible to continue them to make use as tools for our disposable to improve people's lives. So the British Nutrition Foundation was the first body to actually come and say that they would continue using it within the ADI limits. Now, we have recommendations, whether it's from the ADA or the British Dietetic Association and the EFSA, which is the European Food Safety Authority, which again talks about using the sweeteners within the acceptable daily intake limits. And even now, the RSSDI NIN guidelines, which are going to be released next, in fact, on the 15th of this month, have the same message to convey. Now, this is another thing which is often discussed. And in fact, in the morning, there was a huge discussion about this, about it causing gut dysbiosis. So gut microbiota dysbiosis, because we definitely are more concerned about it. So despite the approval of several sweeteners by FDA as GRAS, there is a growing concern about the harmful effects of NNS consumption, especially on gut health, and whether it interferes with the sweet taste receptors. However, let me tell you that if you look at most of the studies, especially the studies done internationally, they have been done using the sugar-sweetened beverages, using the NNS, like all your, diet drinks. And if you look at our country, we really do not have a large population using a lot of diet drinks. So if you look at the kind of, amount of diet drinks that people consumed and the studies that were done on, it is around 21 diet drinks per week, where it will cause some kind of a gut dysbiosis or even other health issues. Now, if you look at our countries, and I'm sure all the dietitians here will agree with me, that we do not have our population consuming so much. They would use it maybe as a tabletop sweetener. And therefore, again, we have to be very specific when we are doing our recommendations as to how should they consume the NNS. Now, this is sorry, I'm not able to see my slides. Okay, this is an RCT again, where they actually looked at daily repeated intake of pure aspartame or sucralose and its effect on gut microbiota. And they saw that within the ADI limits, it actually does not, cause any kind of gut dysbiosis. So daily oral consumption of beverages sweetened with around 136 milligrams per day of sucralose or 425 milligrams per day of aspartame did not measurably affect the gut microbiota in healthy participants. There were no changes in the gut microbiota structures that were detected, and SCFAs were also unaffected by aspartame or sucralose consumption. And therefore, we need to do more Indian studies. And I would recommend and I would urge all of us to actually get together to look at doing more Indian studies to see whether in our population, what is the kind of impact it has, especially that the way our population consumes it as a tabletop sweetener, adding it to their tea, coffee, or any other beverage. Now, this is the latest RCT for India. And like I said, Dr. V. Mohan's team is doing a lot of work, with non-nutritive sweeteners. And I think this is something that is very important, that we need to look at it in our own Indian population. And what they did is they did a 12-week study. It's an RCT using 210, with 210 participants with type 2 diabetes. And what they did, the intervention was they actually replaced the sugar in the tea or coffee, so in the beverage, with sucralose. So, they just did that replacement because that is how our population consumed it, and the control continued to use sugar. So what they actually observed was there was a reduction of 60 kilocalories from the added sugar, because the non-nutritive sweetener sucralose will give you no calories, and they only used it as a tabletop sweetener. And it also showed no changes in glycemic, lipid, or inflammatory measures, but resulted in small reduction in body weight, BMI, and waist circumference. So this was a very encouraging, it was like a relief to all of us, especially because we have so many patients asking us that, can we use sucralose, or can we use stevia, or can we use any kind of NNS? And we were all concerned after the WHO directive came out, and also the studies that are published internationally. So this is a study from India, and Dr. Mohan's team is doing more studies with your, non-nutritive sweeteners, especially with sucralose. Now, again, if you look at the meta-analysis demonstrating the effect of NNS on glycemia and glucose homeostasis, you see that most of the studies will actually show you that there is no increase in blood glucose level. The blood glucose levels, in fact, decreased, and there was no effect on insulinemic responses or the mean change in postprandial glucose level. However, if you look at the study by Lawner et al., you will see that they reported an increased risk of diabetes. But again, if you look at it, it was with artificially sweetened soft drinks. And therefore, while we are recommending any kind of sweeteners to our patients, we should be very, very clear and emphatic that you should only recommend it as a tabletop sweetener. It can be used in your beverages, whether it's tea, coffee, or your milk, but preferably avoid guzzling down, drinks which have got NNS, because we really do not know the amount of NNS in these, sugar-sweetened beverages. And again, we see a lot of people who will order a burger and then a diet drink, and that really doesn't serve the purpose, because people think, oh, I'm eating healthy, but honestly, they're not really doing any good to their health. Again, this is something I'm sure which all of you will agree with me. And Diwali just, finished. And now we have the new year coming in. People often gift sweets which are, made from, jaggery, or made from honey, or your, dry fruits. And they think that, these products do not really have sugar and do not have any calories or carbs. So therefore, it's very important to tell them that sugar-free does not mean carbohydrate, calorie, or fat-free. In fact, a sugar-free may sometimes have a lot of fat, especially if they're, gifting these sweets to their relatives and friends, or even consuming it. And also because, in their mind, it is sugar-free, they in fact will have more. They will have, instead of having just a small piece. And we've seen that, a lot with our people with diabetes, that when they're ordering a cake which is labeled sugar-free, instead of eating one small piece and being mindful of what they're eating, they would actually sometimes eat maybe half the cake, or sometimes even the whole thing, because they feel, oh, this is sugar-free and it is completely safe for my health. So therefore, we have to be very, very, we have to give them the right direction, that sugar-free does not mean carbohydrate, calorie, or fat-free. So to conclude, we need more Indian-specific studies to fully understand the health implication of artificial sweeteners. It is best to cut down on non-nutritive forms of sweets, and I think this is applicable to everybody. And in fact, a lot of people who tell us that they have sweet cravings, especially after meals, we have to look at, what is their meal really comprising of. And we've seen that sometimes they do not eat enough protein in their meals, and therefore they have this urge to have something sweet after their meal. So, we have to address what is the root cause And then, of course, guide them in what are the options that they can choose. And again, we cannot go ad libitum with fruits because, I think we have a very diverse population in our country where there is somebody who can't even afford one fruit a day to another, and I'm sure Neeti will agree with me because she sees a lot of them. And then there is somebody who will have platters and platters of fruit, whether it's breakfast, lunch, dinner, bedtime, thinking that fruit is absolutely safe. And we're also seeing in this population, we are seeing MASLD, we are seeing hyperuricemia, we are seeing hypertriglyceridemia. And therefore, we have to be very, very careful in terms of how much fruit is allowed and recommended. Reducing the amount of added sugar as well as artificial sweeteners in our diet eventually decreases our sugar cravings, and that's better than worrying about their side effects. So just to give you the final conclusion that when consumed in moderation, they are safe, because anything, even if it's healthy, in excess is not going to be good for health. So thank you so much for your patient hearing, and I'll be happy to take any questions if there are.